Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with skin cut or tear, also known as a skin laceration. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with a skin cut or tear, also known as a skin laceration. Having your skin cut can be a very scary experience. Sometimes there can be a lot of bleeding and it can be difficult to stop all of the bleeding. Oftentimes, there's also a significant amount of pain. The first thing your doctor will do is to make sure the bleeding is controlled. Your doctor may apply pressure to stop the bleeding, or they may even put in emergent stitches or sutures to stop the bleeding. Of note, if your tetanus vaccine is not up to date, your doctor will also recommend that you get a tetanus vaccine. Next, your doctor will take a look at the injury and check how deep it goes. Your doctor is checking if there are any cuts into the muscle or the tendons, which connect the muscles and the bones. If the muscles or tendons are cut, these will need extra repair. Before checking your wound, your doctor may inject a numbing medication into the injury. Don't worry, although it burns, this shouldn't hurt too much and will help tremendously with the pain. After giving you the numbing medication, the hard part is over on your end. Your doctor will likely start closing your wound by bringing the edges together. Your doctor may use a variety of different sutures or stitches to do this. Your doctor may also use medical skin glue or medical tape if the wound is less severe. Depending on the type of wound that you have, the final scarring and look of the wound can be variable. If the wound is very simple, meaning a straight line which is not deep, the wound may have very little scarring. However, jagged cuts from dog bites, certain types of fights, or certain saws may have skin that is very difficult to bring together, which may leave a significant scar, even with stitches. Your doctor will use their expertise to attempt to give you the best results possible. To give yourself better results, you can cover the wound from the sun to avoid having the skin of the wound become more tanned than the skin around it. After your doctor closes your wound, you can also improve the wound healing process by keeping it moist with a petroleum jelly substance. This keeps the skin of the wound from drying out, which helps your body get the necessary inflammatory molecules into the wound. Make sure to keep the wound clean to avoid infection, and if you start to notice redness, pain, or any yellow or white discharge from the wound, it is very important to come back to the emergency room since these may be signs of an infection. If your doctor uses stitches or staples instead of glue or tape, they will instruct you to come back to the emergency room in a certain number of days to get your stitches or staples removed. This will range anywhere from 5 to 10 days and is usually to make sure that the skin has started closing on its own. In that time, you are able to shower and perform other activities. However, make sure to keep the wound clean. After some time, your doctor will explain your results to you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.